Hey, I hope you're doing well, but maybe if you came to this video, maybe you're not feeling well. I have a lot of information to give you, whether or not this is something you're dealing with. At least it's something you can think about and inquire about and research and stuff like that. The topic of this video is, and I was damaged, not in the normal way, but I still suffer with the disease caused by what I'm going to tell you. So my question to you is, did you have pain, whatever type of pain? Let's say it was birthing pain and you had an epidural, or you had a slipped disc, you had problems with your back, your iliac joints, anything. And what they do is they put a needle, steroid shot, in the epidural space of the spine. Let's say you got a spinal tap because it was the only way to look to see if you had cancer or other certain diseases. For whatever reason, and what I'm saying here are invasive procedures, not ones that just go skin deep. Okay, those don't. They may cause a little bit of nerve irritation, and I'm sure sometimes they cause some things, but if this is you, I am willing to help you try to find out what's going on. I'm trying to think. Have you had back surgery and you found that you got much worse after that? It's called failed back surgery syndrome. And then the last thing is, have you ever had blunt force trauma, as was my case? Blunt force trauma to the coccyx, or you fell, you landed on your butt. You may have hurt your spine further up by being hit somehow. Now I'm going to get into what... Now before I get into that, I'm going to say, after these injections that you got, you could have had it once. It doesn't matter, it just has to happen once. You could have had a whole set of them. I believe they do also lumbar sympathetic blocks that are epidural. So listen, if you have any needle, so let's be serious here. We're talking about needles entering the spinal epidural space, which lies right next to the covering layer of the spinal canal. So it's called the dura. I use what's it called, an acronym, sometimes to remember difficult medical terminologies and stuff like that. I use like acronyms, you know, like I call it DAP, D-A-P. I just, like, I'll throw, let's say I want to remember a country, and there's a whole bunch of countries, let's say a whole bunch of countries. I'll look at them and I'll be like, oh, you know, like that spells out S-A-M-E, like same. I'll remember that, so I'll remember what order they're in. Anyway, it's the same thing. So I say DAP, dura, arachnoid, pia mater. So that dura mater is a very thin covering. If it punctures that dura mater, it will enter the arachnoid space. If it's punctured, so before I get into that, so this is what I'm worried about, and this is what I'm trying to make people aware of. So what develops, or which I'll talk about in a second. Do you notice after you got this, you got worse? Like clear cut, very clear cut. It's not always going to be the case, but let's say you went in for back pain and they gave you a steroid injection, and you know sure as hell that you got worse after they gave you an injection into your spine and your dura after your birth, after a spinal tap. that you got worse. And what you started noticing, maybe your legs going numb, pain in your legs. It could be very severe very quickly, because with what happens, it's a disease. With what happens, there is no telling how it will progress. It could progress over a number of years. It could progress within 6 months to its maximum degree. Do you notice a lot of pain in your legs? Are you starting to get shocks up your legs? Are your legs burning like it feels like someone's has neuropathic pain? It's just burning. You can't stop it. It feels like fire. Your lower back really aches and burns. Your hips hurt. I don't know what period of time you're in since your whatever injection you have gotten into that space. I'll tell you very clearly that I don't care what Big Pharma or anyone would come out with a counter to what I'm saying. Let's say I got 50 million views for this. I can guarantee you Big Pharma would come out with something to counter what I'm saying, but they would still be wrong. The spinal epidural space was never, no matter if you're getting relief from pain or not, was never meant to be touched with very sharp objects. Would you put glass in your spinal canal? In your epidural space? Well, you're putting something probably sharper than glass. A needle, the tip of a needle. A lot of things can go wrong. Only you know what has happened to you. This is what I have and what I suffer with is the worst pain disorder on the earth. It's worse than complex regional pain syndrome. I have that too, but full body. So I do know, and I know others who have both of these and agree. And it was thought to be rare at one point, but it isn't that rare, because the world is using epidural steroid spinal shots. We live in a time where people are doing, the huge exercise. Everyone's getting it. We live in, you know what I mean. There's a lot of people in the gym trying to make their body look good, and a lot of people ending up with, and on construction sites and all that type of stuff. So people are slipping their discs all the time, and they're getting shots, or they hurt their back somehow. Maybe you sit in a cab, maybe you sit in a truck for too long or something like that. Pardon me, I got to take little breaks. It's difficult for me to speak, but I'm going to give you an example of something. Yeah. So much stuff in there. So you may have tingling, numbness, pain. You may feel like it's more difficult to walk now. Like when you go to walk, it might feel like you're wading in a stream, like you're fishing. Like you're going out to fly fish and you're like going against a stream. Like you got 2 chocolate bars in your hand, you got a pop in the other. No, I'm just kidding. The people who give these injections, okay, I'm just checking if this is recording. People who give these injections, it can vary. Now, I'm sure there are places where there are people who aren't properly trained, people who could be not well, could be tired, could be fatigued, right? Could be rushed, could be unlearned, could be their first time. They come across you and they're ready to give you a shot in your epidural space of whatever it is, a block, like a nerve block, a steroid, a pain medication, morphine, whatever it is, right? And remember, this can be blunt force trauma too. And they take a needle, right? I don't have anything, really, I do. So let's just picture this is your spinal canal, okay? And let's just say the space, here's the needle, and they're going to want to, this isn't exact, okay? I didn't plan this. They want to do a little space here. They want to get that needle and inject whatever it is that they're putting into there to give you pain control. There are many times when they slip and go, oop, like that. And that little layer called the dura mater, the dura is a, sorry, I feel kind of funny, is a very thin layer, okay? It's a very thin layer. And think of how easy that is. And a needle would be even sharper than this X-Acto blade. On the tip it would be. And it's so easy just to pass right through it. So the question is, what happens? Just give me a second here. Let me make a cake first. This is actually a very serious matter and why I make this. I'm doing a, I don't know, I guess you'd call it community service type thing. You know, like I'm willing to, I think I pushed, no I didn't. I'm willing, you know, like to, I want to try to help somebody. I can only help so many people though at once. If you feel this is you, just actually, what was I going to say? Yes, the process, sorry. So when that hits the dura mater and it pokes through, and it's, we all have different physiology, right? We all do. It's going to depend on something. So obviously, how far did they poke into it? Was it just a little poke, whatever? This is what matters, if it poked through. I'm sure, you know, there are cases when people slip through and they remember them saying, oh, you know, like something like that. I've heard that before. That's horrific, man. These things were never supposed to go through there. Never. They're never meant to enter that space. Just like things like Elon Musk's brain chip were just never meant to go in there. That's just my personal belief. But so what happens is it begets a progressive spinal inflammation. Okay, so when it pokes through, it creates inflammation. That inflammation is called arachnoiditis. That, it sounds like a spider, right? Arachnoid, which means when they look at it on a telescope, microscope, it looks like a spider web. All the scarring, okay? So that's arachnoiditis. Arachnoiditis means inflammation of the spine. When it gets to a certain point, so it's progressive, you can't stop it, but you can slow it to a certain point if you take your proper measures in life, medications, and probably diet, just trying to stay well. But it's a horrific disease, and I have the end stage, which is once it progresses to a certain level, that scar tissue starts attaching. It just keeps building, okay? Like it begets more, begets more, begets more. It starts, let's just say, this is a nerve root, okay? All this inflammation starts, scar tissue starts building around it. And if you have, let's say this is like your nerve root and the canal's like this big, it attaches. All the scarring around the nerve roots attaches, and it attaches to other nerve roots. So you have nerve roots starting to clump together. That's really painful. It's like MS, but on steroids. A lot of the same symptoms. And it becomes what I have when it gets to the point where it adheres to the wall of the canal. So you got nerve roots stuck to each other, and now it's stuck to the canal wall by scar tissue. And I do have the proof on MRI. I can't remember if I erased that video. I wouldn't have erased it. I would have hidden it, but I think for the sake of other people wanting to see MRIs, I think I kept it up. You're gonna have to look way back in my videos. The thumbnail should be a picture of an MRI. And then in that case, it's called adhesive, which means to adhere, right? It's pretty simple. Adhesive arachnoiditis, adhesive spinal inflammation. When you first get it, it's called arachnoiditis, then it turns into adhesive, and that's the worst pain disorder on the earth. It really is. A lot of people cannot walk. They're virtually paralyzed. I guess you could call some people paralyzed. Some people, I don't know if there's people who can't move at all their legs. I couldn't walk. I couldn't get up and do my own thing because I was in so much pain. I was on a couch in bed for almost a decade, 9 years. So be careful, and only you know what happened. I'm going to tell you of one story. I'm going to leave my email address. I don't, anyone who tries to mess with me and do this, I just say, you try to do a good thing for some people, and they try to mess with you because there's a lot of bad people on the internet. They just hide themselves. I'm going to leave an email address if you feel that's you and you want your spine checked. This is the good part. I have direct contact with the man who, in California, his name is Dr. Tennant, and I send people to him when I can. So I've sent about 3 or 4 different people to him, and I just spoke to him the other day, the thing is, though, I don't so all I have to do is email or call him. So I do have his phone number. And if you feel it really is, then, and if you're that hard up to find out if what I'm saying is what happened to you, I'm going to give you a quick story. I live in an apartment building with quite a lot of people. Like just my place alone could be 700 or 1,000 people. There's the other apartment buildings around where I live here. There's like six of them. Just in this space, I am able to spot someone who likely has it. Not every time, because you never know what else a person may have. I started talking to the person. I noticed that they went from walking to just having a lot of trouble, just like almost overnight. And it can happen that way. You can have progressions. And I talked to her, and then as I talked and got the story, I realized she got a spinal tap and she felt really, really sick afterwards. She got a migraine, her blood pressure went up. It sounds to me like penetration from a spinal tap. That's horrible. I helped her send her results, fill out stuff, and give the story to Dr. Tennant. Sure enough, she got the diagnosis of adhesive arachnoiditis. And they'll point to you on the MRI. I can point to you on the MRI where it is. Pardon me a second. I'll leave my email address. I will answer you once, and then after that, it's got to be a phone call. It has to be a phone call, because I'm not going to let people mess around with me. So this is what people do these days. So, and I would say this: if you're really wanting to do this, like this is a specialist, okay? He's a physician who dedicated his life to this. This is virtually an unknown thing in the medical world, and he's worked so hard to write medical papers. Go look up Dr. Tennant, all about him. And no, he's not a fraud doctor. He isn't. They kicked him out of practice because he refused. He treats people with the worst pain in the world, okay? Cancer, adhesive arachnoiditis, which is equal to terminal cancer pain. And well, it'll end up that way if it progresses enough. And so they kicked him out of practice during the opiate crisis because he refused to give the amount that he was to his patients. He's a good man. He's wrote some pretty good intractable pain papers. So here's my thing. If you want to do this and you're that hard up, you can have a free specialist that you would otherwise not see. And otherwise your radiologist may not write it down even if they see it. I'm telling you the truth. I could literally, you say, where is it on the MRI? They'll show you. I will show you too. It's easy to see the scar tissue if there's enough of it, and if it's adhered to the wall, and if you have adhesive arachnoiditis, it's like a 95 to 99% specificity. Think about that. But the only thing I would ask you is to, if you want to do this, you'd have to give a small donation. That's what I'm asking. I think that's a very small thing to ask, not for me, and I'm not asking you to give it to me. I would be asking you to send it over to him, because even though he's doing this without asking for one, he's using his time to do this. This is a once-in-a-lifetime chance, or else you're going to spend like I did. I went 13 years not knowing what it was, and I was very sick. So I'll leave my email. I'll try to make the best thumbnail to get people's attention, but if you think this is you, I feel sorry for you, if it really is. But there's good news. There are more treatments than there used to be. If you suddenly went downhill after you got a needle in your spine, your spinal epidural space, that's not good. It may not be, and I'm not guaranteeing you that it is, but it's worth a look if you cannot find anything else. And that's the problem with this disease. Thanks for watching, guys.